Hey mamas, it's Kristen from Action Potential, and one of the topics that I often get asked about is pubic symphysis pain. And this is a really common syndrome that occurs when pregnant. Typically, people will feel the pain right at the front of their pelvis, kind of just above their vagina and in between their legs. And it can be a really sharp, searing pain that occurs with things like rolling over in bed, maybe it's going up and down the stairs or standing on one leg, getting in and out of the car, or even just something as simple as walking. A little bit about pubic symphysis pain. As pregnancy occurs, the hormones that are released during pregnancy make the ligaments very loose in the body to allow the pelvis to expand for passing the baby through the pelvic opening. One of those ligaments is the pubic symphysis, which is located right here in between the two pubic bones, just here between the legs. And that can often get jarred or stretched as a result of that relaxation. Particularly if you've had an event where you've fallen or maybe landed on your rear end in a very tough way while pregnant, that can actually cause this joint here to shift slightly out of place, which can cause some pretty significant pain there. When that occurs, there's a couple different ways that we treat that issue. For one, if we do see that there's a little bit of a disruption, we can recenter that joint through some manual techniques. And then in physical therapy, we would also teach you how to stabilize using your muscles of the pelvic floor and abdomen to make sure that the pelvis was getting the support that it needed so it didn't feel like it was being continually pulled apart and stretched. Another option for reducing pain there would be a pelvic stability belt. There are several that we recommend for our pregnant moms. However, I do like to caveat that by saying you want to be cautious about using a pelvic stability belt too much because that almost puts a Band-Aid on the situation and further weakens the muscles. And certainly as we prepare for delivery as well as postpartum, we want to try to keep those pelvic floor and abdominal muscles as fit as possible to ensure a very healthy recovery. If you have any questions in regard to pubic symphysis pain, please visit our landing page at reachyours.com/pelvic health, and we can address any of those issues that way. In addition, you're welcome to reach out to us via email at actionpotential@reachyours.com. Thanks so much.